Kelly OMD. I am so excited. The conference that I've been attending, or symposium as you want to call it, has been amazing to actually be in the room with fellow colleagues that are in the healthcare executive arena, but for the right reasons, because we want to all take care of patients the best way we can at the most affordable price to the patient as well as the organization that we work for is just amazing. And then to have leaders, true leaders, so surgeon generals as well as CEOs and researchers in this realm of healthcare to speak with us is also motivating. Sometimes, and you go through times in life, and I'm going through it right now. A lot of my friends are going through it where they're just confused. Like, what do I do next? I've reached a pinnacle in my life where I reached the dream that I initially had when I was younger. I have been identified as a mover and shaker in the arena that I'm in. However, I feel like I'm getting to a point where doors are being closed or nothing's being open, nobody's talking, people are confused or frustrated. I'm not sure if this is what you call a midlife crisis. Not really sure about that because it's the first time I've ever been midlife. However, I know that I have been given not only do I have passion, but I've been given a vision about how we can really change healthcare for people who need it the most. And people that need it the most, to me, are not necessarily the socioeconomic people that have the lowest socioeconomic status. People who need it the most are those who need somebody that will take the time with them, that will be patient with them, that will listen to them, so that they can really understand their family history, their background, where they're coming from, as well as what's going on in their community. I mean, I live in the community that I service. And some people may look at that and say, oh, you live in a low income community. As far as I'm concerned, my community is very diverse in income. It's very diverse in ethnicity, culture, and everything like that. But I also get the chance to see what it takes for a patient to actually come see a provider. How many buses are they getting on? How many trains? How much does all of that cost? How much time does that cost? How much time do they have to spend away from their small businesses, their, work as far as being employees? And even when you are making a lot of money, how much time is that taking you away from being able to be the role model, mentor, advocate, or sponsor that you're trying to be, because you're trying to get your health taken care of, because all the health is focused on being in the hospital or being in the clinic, and nobody is really coming out to you. The other thing is, the passion that I've had has always been in volunteerism. And I realized this since I was young. I mean, I worked at a women's shelter, teaching women how to balance their books, so finances. I've helped create programs for women that have had domestic violence issues. Xavier Men Against Rape when I was in college. I have volunteered at a number of places. I have essentially Vivalife Health Hub is a program that was created for a nonprofit organization that is addressing the social determinants of care. So when you talk about food, when you talk about housing, preschool education, first 5 years of life, as well as healthcare, we're doing all of that in Logan Heights CDC. But it's not just staying in San Diego. Now we have a voice, we have a way through social media to help people understand, how can I truly change not only my community, not only my nation, but how can I truly change the world? And I hope that I'm demonstrating this to you and showing you how to really get out there. Align yourself with the people in your community. And if your community is not a community that is truly servicing the people of the community or people that need it the most, then find one that does. Don't be afraid to live in that community. Don't be afraid to be a part of the community. Be a mentor, a role model. Shape what's going on. I am not perfect, and I tell you guys that all the time, but I'm trying my best to make a difference. So this week has definitely been a high point in my career, in my personal life. It has sealed the deal that I no longer have to straddle what I'm trying to do within my organization as well as what I'm doing in the community. The goal now is to bring that together. And in bringing that together, we are going to change the face of health for those who are at most risk. And even those that have plenty of resources, they still have health risks and they still need to be listened to. So I hope you have a wonderful day. Don't forget to do what? Viva life. Bye.